Hello, my name is Fedor Milikh. I am a clinical psychologist. I am engaged in personal psychological consulting. My specialization is psychosomatics. My field of interest is the assessment of personal risks of psychosomatic pathology development. All of you, I think, have heard the expression more than once: all illnesses come from nerves. I paraphrase it: all illnesses come from unexpressed feelings and emotions, and also from various failures and problems in life, in relationships with loved ones, friends, and colleagues. Every negative human emotion is the cause of the development of diseases that are called psychosomatic. For example, suppressing aggression creates dental problems, causes gallbladder disorders, leads to chronic stomach disorders, causes hypertension and migraines, and suppressing hate creates problems with the skin and cardiovascular diseases. So, a person experiences and suppresses a wide range of negative emotions. This is the first stage in the formation of psychosomatic illness. It begins a vicious circle of 7 stages. After suppressing negative emotions, a person experiences stress. The prolonged experience of stress leads to a violation of regulatory mechanisms in the body. The body is depleted physically and functional changes begin in it, which inevitably leads to the transition from emotional problems to physical at the level of individual organs, and after this inevitable disease and suffering from it. Suffering creates stress, and stress increases physical illness. The circle is closed. The person finds himself in the situation of a snake biting his tail. The stronger his illness, the more stress in his life, and the stress only increases the illness, and so on to infinity. My goal as a clinical psychologist is to break this vicious circle. Psychosomatic illnesses are about 80% of all diseases known to medicine and are practically untreatable with medication. Most doctors are afraid to show their incompetence and would rather prescribe new medications, procedures, showing active help to the patient, but will not send him for help to a clinical psychologist. However, you will need the help of a medical psychologist and a doctor to correct your psychosomatic condition. In normal countries, the medical psychologist always works together with the attending physician. Why is this so? Because without correction of the psychosomatic condition, the usual treatment does not work. What does a medical psychologist do? First, he conducts a special diagnosis and determines the degree of psychosomatic damage. Secondly, the psychologist prepares a special opinion for the attending physician so that the latter can develop an effective medication therapy. In turn, the psychologist corrects the client's psyche. The combination of medication therapy and special psychotherapeutic techniques is the correct and effective format of treatment for psychosomatic illnesses. There is no other way. And right now I suggest you take a TUSH test and assess the level of risk of psychosomatic pathology in your case. And after that, the testing system will tell you which of my consultations you need. Be healthy, and don't postpone our meeting.